We now move on to question 92, which has been asked by the Honourable Clerk to the Minister of Health. The question is on funding of the National Health Insurance. The Honourable Minister.
Thank you, Chairperson. Honourable Member, let me start by correcting something that is grossly wrong in the question. The National Health Insurance never made any proposal whereby each South African will be provided with same quality of healthcare only under private healthcare, as your question suggests. What the NHI proposes is that all health facilities, public and private, have to be accessible to all South Africans if and when their health needs demand it. But this must be done, obviously, in an affordable manner. Now, let me deal with this claim of 1.3 trillion. You are aware, honorable members, that 1.3 trillion is the total budget of the government. Now, the publication of this number is disingenuous and deliberately circulated to anger the public because it will sound crazy for the state to introduce a health financing system that will cost the same or even more than the total budget of the country. You know, Chairperson, this calculation, I've described it in certain terms and I want to repeat it here. I said the person who did it was practicing mathematical hooliganism. Because of the manner in which it was calculated. It's mathematical trickery. You are tricking people. For those who don't understand, it is similar to if a minister of housing stand up and say, all South Africans need to have shelter. Nobody can challenge that. Somebody goes to Sandton or Bantry Bay here and you take the most expensive house in which a billionaire lives and you multiply it by 69 million, 61 million people and you say this is what the minister is proposing about housing of South Africa. That's exactly what has happened here. And that's why I called it mathematical hooliganism about the person. And the person who made this calculation is obviously an interested party because he's making a lot of money from the healthcare by being a medical aid. So this is wrong. Now, this calculation also makes a very wrong assumption that we are going to abandon all public clinics, all health centers, all ordinary hospitals, all academic hospitals, and general practitioners, and go only to private hospitals. How possible is that? Now, your last question is the impact this calculation will have on taxpayers. I cannot, in my right senses, investigate impact about something that does not exist and is not going to exist. Thank you.
The first supplementary will be asked by the Honourable Clerk. Honourable members, order.
What's wrong with your ears?
Honourable Clerk.
Thank you, Chairperson. Well, Minister, surely you've got to get the same health care, no matter if it's under public or private hospital, in terms of the Constitution. And I'm sure if you look at that, that is what everybody would want, because that's what NHI prescribes. We will get the same quality health care in a public hospital, and it should be universal to everybody. And you are saying today that that is not the case. So maybe you can answer the following for me, Minister. Can the Minister please advise what the cost of the massive NHI roadshow was, both in total and per region, the specifics of its funding within the department's budget? This would be detailed as a specific project funding related to the NHI initiative. And can the Minister please advise us under what section the budget was used? Why were many civil society groupings and private medical stakeholders not included in the current roadshow? One would think the decision would be guided by the government's strategic objectives to achieve a broader consultation announced in the SONA debate by the President. This exclusion, however, has raised concerns around transparency Minister, your dismissal of valid concerns around the NHI is very concerning. I thank you.
The Honourable Minister.
Honorable member, I want you to listen to what I'm saying, not to what you want to hear. I never said, yes. I never said people are not going to receive quality health care. Quality health care does not necessarily amount to expensive health care. Doesn't amount to that. And some of the charges that are there in the private healthcare sector, and I repeat, we never said we are going to abolish it, as people are saying. But some of the charges are ridiculous. It was even said so by the market inquiry, headed by former Chief Justice. If you go to a GP, a general practitioner in a township, and do a circumcision, you will pay 1,800 rand. But if you go to a private hospital, you'll pay between 15 and 18,000 rand. Now, is that fair? Are you going to say GPs are not doing the correct circumcision? Is that fair? Why do you think quality health care has to be necessarily expensive? It does not follow. Now the second question. I am absolutely puzzled. Every single minister here, or anywhere in the world for that matter, ministers are allowed to go out and talk anything about their department with members of society, anytime they are called or they want. I was surprised why I'm being questioned while I'm doing roadshow, how much is costing and all that. I've got the right to go out to talk to anybody about any program of the department. That includes NHI. And I've never excluded anybody. I've got a list. I've got a list of people who have invited me to go and address them. I've been to churches. Tomorrow, I've been called by the media. There's a debate about NHI. I'm going there and I don't owe you any explanation why I go there. I will go. I've been called by Contralesa. I'm preparing to go to them. I was called by churches in Limpopo. I'll go to them. If you call me, I'll even come to a house and talk to you about NHI. And I'm not going to explain the cost to you. So I am not going to entertain what you are saying. I'll go out. Every minister is allowed to do so. Why don't you ask all the other ministers when they go and talk about housing, water, social development, education? Why are they
Honourable
not
Minister, your time is up.
No.
Honourable Minister. Honourable Mkalipi, is that a point of order? And please state which point.
Deputy
Honourable
Speaker,
Members' order, we cannot hear. Which point of order are you raising on?
Deputy Speaker, what are you going to do when GNU falls with your position?
Honourable Mkalipi, that is not a point of order. The second supplementary question will be asked by the Honourable Blomo. Second, honourable members, Minister of Water and Sanitation. Good afternoon, Minister, but could we please just keep it down because no one can hear what is going on at the moment. The second supplementary question will be asked by the Honourable Blomo.
Thank you, Minister. The data that is available from the World Bank, WHO, and many other such institutions will tell you that when you compare the total expenditure on health, percentage of GDP, looking into various countries, but let's just focus on BRICS. South Africa is spending 8.5% of its gross domestic product on health. Except for Brazil, that is spending 9.8. All other BRICS countries are spending far less on their GDP spend. India, for example, is 3.8 and China is 6.85. But paradoxically, the health outcomes of these countries are actually far better than what we have in the country in South Africa. We look into the very few. Let's look at the life expectancy. All these countries, their citizens live long up to beyond 70 years. Number two, The maternal mortality rate of these countries are low, are less than 100,000 of women who deliver babies. We are sitting above 100. The infant mortality rate, babies who are born
Honourable
in those
Member.
countries.
Please round up your question. Your time is run out.
Okay, let me round up. The infant mortality rate, the under 5 mortality rate, Minister, are all what is this? When are we going to have this 8.5 really benefiting? Because our outcomes do not show that we have such a budget that is dedicated to health. Thank you very much.
Honourable Minister.
Thank you. You know, Honorable Member, the recommendation from the World Health Organization is that if countries spend 5% of their GDP on health, they ought to have good healthcare systems for all their citizens. That's a recommendation from WHO. We in South Africa have far exceeded that recommendation. We are at 8.5%. So your question is, what's wrong? What's wrong is that 51% of it goes to only 14% of the population. Unfortunately, that 14% includes all of us here. We benefit from that 51%. If you want to see how this affects countries, the same document you are talking about, if you are talking about the same graph I've seen, from the World Bank, you see, it has got something that is heart-wrenching. That of all the countries who spend most on health in the world, the US is number 1, Lesotho is number 5, we number 16. Sounds like a joke why Lesotho is number 5. It was one of our private hospitals here, went to Lesotho. I'm not going to name it, one of the private groups, went to Lesotho. Their biggest hospital is called Queen Elizabeth. They said this Queen Elizabeth is dilapidated, no equipment. Let's build you a world-class hospital with equipment. And they did so. They even tricked them by saying, Queen Elizabeth is a colonial name. Name the hospital under your queen. And they name it Queen Mamuhad. That hospital is unaffordable. The Lesotho cannot afford it. And they are paying about half of the total budget of Lesotho only to that hospital, money that comes into a South African private hospital group. These are some of the things that we want to change. And what happened to Lesotho? Go to Lady Brand Hospital. We have got a brand new hospital there. The biggest ward in that hospital is 4 beds. It's like private hospitals here. But get into that hospital, you find Lesotho women. They are coming to South Africa because their hospital has been taken over. And they are number 5 in the world in healthcare expenditure. We are number 16 in that graph of the World Bank. We have exceeded many countries in Europe because of these expenses that you are talking about, which many
Honourable
people
Minister.
like us to believe they are from God. They are not from God. They
Honourable
are
Minister.
and we can reverse them. Thank you.
Thank you. The third supplementary question will be asked by the Honourable van Staden.
Thank you, Chairperson. Since the tabling of the NHI bill in 2019, I've raised a question on how the NHI will be funded, and every time the ANC and the then Minister argue that the NHI will be tax funded, well, we all know that the tax base in South Africa is getting smaller every year. The official opposition at that time, earlier in this year, around March, warned that another 859 billion was needed to fund the NHI. And Momentum's recent estimation of 1.3 trillion a year is a matter of great concern. Now, my question is, while the Minister of Finance could not provide the Portfolio Committee on Health with a finance model, can the Minister inform South Africans today for once and for all where the funding of the NHI is going to come from? If not, why not? And if the Minister really believes that already overburdened taxpayers will simply accept another form of tax to fund the NHI. Thank you, House Chairperson.
Honourable Member, that indeed was also 2 questions, but Minister, if you want to answer both.
Yeah, no, are we?
please do.
Why not? We. You see, Honorable Chairperson, we had a sketch of a disease called HIV/AIDS, which was the biggest in the world. In 2010, we put up a program whereby we're going to run the biggest HIV counseling, testing and treatment campaign in the world, which today is, he was, yeah, it's exactly under him, but he was taught by me to do that. Because no, no, no. No, you can go and ask Msholozi. I sat with him. You can go and ask him. I sat with him and showed him what we must do. And we did it. When we published that, I was asked a question, where will the money come from? I was asked the question, where will the money come from? If I repay you back, I refuse to answer that question. You can't, when people are dying and you have got to treat them, start asking questions like that. The medical aid, the first policy of medical aid was enacted in 1967. Nobody stood up and said, where is the money going to come from? They established private hospital, private healthcare, medical aids. Nobody asked where the money is coming from. So when we want to treat South Africans, even those who are poor, we are saying, where will the money come from? I'm not going to answer that question. Money in this country for housing, for water, for police, for the army, to run parliament, pay your salaries. Where is it coming from? And the second question, that the tax base is getting limited is because there is this sick thinking that only all of you who are rich are paying tax. Show me a single South African who's not paying tax in this country. Show me, because tax, which feeds the government, comes from three sources.
Thank you, Minister. Unfortunately, your time has run out. Honorable members, order. Thank you. The last supplementary question will be asked by the Honorable Letlape. Order. Honorable Letlape, just take your seat for a moment, Honorable Souls.
Chair, I'm just wondering if I can give my supplementary question time to the minister, please.
Yeah, no, Christmas is also coming. Honorable Letlape, please proceed.
I guess, Minister, not all parts of the GNU are not working. My question to the minister is that I'm currently battling. From your answer to the first question, you said the hooliganism, the mathematics mixed with hooliganism was based on the fact that medical aids are making money. In terms of the law, they're supposed to be non-profit. And the person to ensure that they are non-profit is the Minister of Health. I pay 7,000 rands to PARMED, which is too expensive, and I expect you to stop it because it is from a piece of apartheid legislation. How are you going to help me, Minister, not to be fleeced by a piece of apartheid legislation in the new dispensation where I want to be with the people and not with those that take away from the people? How do you ensure that the medical aid permit doesn't fleece me? And
Thank you, Honorable Member. Your time has run out. Honorable Minister, it's not, there's a very tenuous linkage to the original question, but you're welcome to answer.
Yes, I'm prepared to answer. Yeah. You know, Dr. Letlape, I don't know why you are paying so little for gems. Gems is very expensive. I mean, so for PARMED, sorry. My apology. PARMED is very expensive. And I am on record saying that medical scheme should not exist. Even if we are to continue with medical schemes, even outside NHI. To this extent, I met with the trust, which includes speakers of provinces, to make this proposal that even if we keep medical aids, we all go to GEMS. And it was rejected. And my reason is that it should not exist. Insurance is based on numbers. You can't have a medical scheme of so few people. How many are we there in GEMS? It is 490 in Parmet. Thank you, my dear. Thank you. How many are we? It's 490 of us in parliament. Then you go to provinces, 80 in Gauteng, 80 in KZN, 74 in Limpopo, etc., etc. If you add, and then 265 judges only. If you add, it's about 1,000. If you want to understand why you can't have an insurance of few people, just get a life insurance where there are only 10 of you and die and see how much will be paid. It doesn't work. And I don't know why it is allowed. So that proposal was rejected, and that is why we are fighting tooth and nail, that we come with a new health financing system, which is NHI, because of exactly some of the factors that were mentioned. What we are doing here doesn't work, it's too expensive, and that's why we want to change it. Thank you.